millions of dollars of pharmaceutical money going to political campaigns is one. That's probably enough. Disinformation. I was told when I took pharmacology in medical school that back in 1900, 1920, the ethical drug industry developed because most doctors were still making their own medications. They were rolling their own. In fact, in my pharmacology class in 1961, one of our lab exercises was to roll a digoxin tablet, to weigh the right amount out and to put in the additives and then use a little pill rolling board and then we were assessed how close did we come to an accurate dose. And it was pretty scary how close we came. And then penicillin was discovered. And then its efficacy was established, especially during World War II. And this wonder drug ushered in a whole series of other drugs, and they all depended on fermentation. So the ethical drug house combined with the brewery and took on the ethics of the brewery, according to my pharmacology professor. So there's a real problem out there of disinformation, we're talking about huge amounts of money that are at risk. 23 million pounds a year, even though it's less expensive than the same drug when written in human prescription. So that's one of my real worries, is that that political pressure will continue to prevent CDC and FDA from doing the kind of probing that needs to be done.
I have a question. Do you know of any of the Healthy People 2010 goals for either obesity or maybe diabetes?
I don't know the precise numbers, but I do know that Healthy People 2010 does have some goals there. Healthy People 2010 also has a nutritional goal of reducing the saturated fat in the American diet by 15% by 2010. And 15% turns out to be just about 1 day a week. So we, with an advocacy group in New York, started a campaign a few years ago called Meatless Monday to try to draw attention to the fact that our saturated fat comes to us through meat products, and that for 1 day a week, eliminating all sources of saturated fat, that means eliminating, unfortunately, because I'm a great cheese lover, cheese and whole milk and other dairy products. Now, even with that 15% reduction in saturated fat, and even if it all came by reducing your intake of meat, the average American by 2010 would still be consuming more meat than in the USDA dietary guidelines. The diabetes mark, I believe it was something like reduced prevalence of type 2 diabetes to 9%. We're already at 12% and going up, so I think we're going to miss that one by a lot. And the other one, I can't remember, what was the other one? Yeah. So for those of you not familiar with Healthy People, it started back in the Carter administration. The first 10-year goals were Healthy People 1990. And they've been used as benchmarks to say to the public health community and to the American people, these are the major causes of premature disability, sickness, and death. And we want to reduce the number of people who are smokers. We want to reduce the number of people with undiagnosed hypertension, et cetera. And each decade, the number of objectives have increased. It's now up to about 235 discrete objectives. But they've been very important in helping public health agencies sort of develop their priorities for policy. The per capita consumption is based on USDA data that comes from industry sources, it comes from wholesalers.
Exactly. It's the slaughter, the amount of weight the slaughter every day is federal expected. So if the population goes up, consumption goes down. If exports go up, consumption goes down.
Right. They factor in exports.
Well, it's pure numbers. I mean, that's what the numbers are. On your grain consumption numbers, if grain production goes up, the grain consumption in the United States go up, or does it depend on exports and the number of people?
If grain consumption,
If grain production goes up,
yes.
okay, and does the consumption of grain in the United States go up, or does it depend also on exports? Because our exports go up and down.
Right, right. Well, no, obviously the translation of year-to-year grain production to year-to-year dietary patterns, I doubt that any of us in this room alters our dietary patterns in a major way in response to what the previous year's grain production. But it does get reflected in the price to the consumer of the finished product, so that there's a certain amount of price elasticity with regard to meat. When meat prices go down, consumption does rise. So I think that's the connection. But there's probably both a lag time as well as some smoothing out of the fluctuation.
The dollar amount of oats in a can of oats is very, very small.
Mm-hmm.
Very, and it hasn't changed that.
Right. Yeah. Well, the main determinant, I think, of American dietary patterns has to do with that $11 billion a year that is spent persuading us what products to eat. And that's where I think we have an opportunity to intervene and bring in line, the USDA's dietary recommendations with the USDA's policy with regard to food production. The question was whether risk of obesity is correlated with lower, middle, and upper class. I was mentioning earlier today, I sat on a doctoral defense for a PhD student in nutrition at the School of Public Health a couple of years ago who had done her research on the White Mountain Apache Reservation. And she found an inverse correlation between food security and obesity, so that the poorest people on the reservation, the least food secure, had the highest rates of obesity. I don't think we really understand how that works yet, except that it seems to be related in part to the fact that the most affordable foods tend to be those that are calorically very dense, high in vegetable oils and fats, high in refined sugars, low in nutrient value, and that's what you see when you go into a corner store in East Baltimore. All the food on the shelf is processed food. If you go onto the White Mountain Apache Reservation, the consumption, the beginning of the month after food stamps are made available, is in general a healthier diet. By the end of the month, they're down to the cheapest things available, which are those high calorically dense, nutrient-poor foods. And was there a second question? Well, there's one of our graduate students with a strong background in economics who is looking at doing a literature review on price elasticity. In other words, how much your consumption of a product changes with the price of that product versus income elasticity. And there's some suggestive evidence that with regard to food purchasing, it's a more accurate predictor of what kinds of food you're going to buy of your total disposable income as opposed to the price of the item. And if that turns out to be true and replicated, then it would obviously present some interesting policy options in terms of food subsidies to low-income families. That's a great question. I think the question is in my imagination. What would the coalition have to look like between the health profession on the one side and those of you interested in and working on sustainable agriculture on the other? I would say that the first task of that coalition would be to share ideas and input to a deeper and richer understanding of ecology, and to really learn from each other about systems and how, there are some fascinating stories that my one ecologist faculty colleague has to tell about using mapping and GPS technology to plot the diffusion of hantavirus in rodent populations in the desert Southwest, down in Peru, and in the rat-infested alleys of Baltimore. And they all behave really quite differently. And so learning about the ecology of the dissemination of disease in that way, and then comparing that to what colleagues in agriculture are learning about planting cycles, about integrated pest management, about nutrient load, about, there are just so many things that I think a fresh perspective through dialogue around a common purpose of improving the quality and sustainability of the food we eat would probably open up all kinds of other opportunities. What in your imagination would make for an effective coalition? Mm-hmm. Good. Yeah. Thank you. His imagination would be to get a small cluster, sort of like the Leopold Center, but the Leopold Center Plus. And whether you have to go to Iowa City to the University School of Public Health, or find some people here in Ames, or send some of your folks down to Iowa City, I don't know, but a small cluster of interdisciplinary to really thrash some of these things through, and then make common cause against those who will resist. Did that capture it? Yeah. It's a very good strategy. I mentioned to some students today that Mahatma Gandhi once observed that first they ignore us, then they laugh at us, then they fight us, then we win. There's certain grain of truth in that in terms of people, I believe, fundamentally do want to do the right thing. And I think that applies for people in public health, it applies to people in agriculture, it applies to people in animal husbandry. And we just have to break away from this industrial model of relying on greater and greater inputs and externalizing all the costs to the rest of society. And if you bring those costs back and capture them, then people who really are interested in the ecosystem and who are willing to put in the extra effort or whatever will be able to compete in the marketplace. It is a dire picture, and I think the honest answer is that right now we collectively in the public health community are very, very sobered by how complicated the problem seems to be, how elusive the answers are. One encouraging experiment was done by a Belgian investigator at Dalhousie University in Nova Scotia. He's now been recruited out to University of Alberta in Edmonton to work on the obesity problem in Alberta. He, in the Annapolis Valley, he took 6 middle schools out of, I think there are a total of about 25 in the whole valley. And in these 6 middle schools, he had an intensive combined nutrition, physical activity input with a lot of health education, a lot of engaging the children in helping to prepare their own meals, understanding more about food, understanding where it came from, and then rigorous prescribed physical activity, restoring daily PT and things like that. And compared to the control groups, they didn't stop obesity cold in its tracks, but the slope was dramatically reduced while the control groups kept going on like this. Sufficient that the school districts of the Annapolis Valley, when they looked at the data, implemented his program in all 25 schools, and now they're following up. That started about 2 years ago. The CDC has got dozens of people analyzing data. We recently sponsored a series of seminars over a quarter. We had 10 seminars, brought half homegrown and half visiting scholars looking at all different aspects. And one of the things that it really comes down to is the fact that we have allowed our energy balance to go completely out of whack. We know pretty well what causes obesity. It's too many calories in and too few being burned up. It's everything from our built environment, the fact that new suburban developments with the lollipop design don't allow children to safely visit their friends and neighbors without getting in the car and being driven around to a house that may, as the crow flies, only be a couple hundred yards away. Kids no longer walk to school. They sit in school buses. Kids sit in front of television 6 hours a day, snacking on nutrient-dense junk food. We can lay out all the inputs to the problem, but how do you turn the American public around? And that's where social marketing comes in, and that's where I think doing something, and I would be in favor of further restrictions on commercial advertising of nutrient-dense, nutrient-poor, calorically dense foods. We've had modest success. The children's television on Saturday mornings no longer has quite the number of high-sugar cereal commercials. But but there needs to be more of that kind of policy change. Mm-hmm. Well, there's a challenge. I think nobody has written the antibiotic resistant equivalent to the omnivore's dilemma, or An Inconvenient Truth, or Silent Spring. You're absolutely right. We have more data about antibiotic resistance than Rachel Carson had about DDT, and so we do need somebody to take on that cause. There are a couple of people who are certainly capable of writing a popular book on that subject, and I know one of them whom I will challenge when I get back to Baltimore and say, you need to be the next Rachel Carson. The question is, do I foresee the emergence of antibiotic resistance, particularly related to methicillin resistant in general? Will there be a whole nother problem besides from resistance? Well, I think the evidence is that let me give you an example of some industry data. One of the big poultry integrators on the eastern shore of Maryland actually collected data comparing their traditional approach of using subtherapeutic antibiotics in the feed and sometimes in the drinking water of broilers versus several growers that they asked to raise the birds without antibiotics. And they collected very careful data on time to market weight, which went up slightly without the growth promoter. It went from 46 days to 47.5 days, something like that. The number of dead birds in the houses went up slightly. And their conclusion was that it was more beneficial to continue using antibiotics. An economist in the Department of Geography and Environmental Engineering at Hopkins and one of our graduate students, supported by the Center for Livable Future, were able to obtain the data and then do a very careful cost-effectiveness analysis. And when they added in the cost of the antibiotic, it turned out to be more cost-effective to go without the antibiotic feed additive, have a slightly longer growth time to market weight, and have a few more dead birds. And that vertical integrator, whose name you would recognize clearly because their headquarters are in northwest Arkansas, has now announced that they're going to abandon subtherapeutic antibiotic use. The ecosystem is still a mystery. There's some suggestion that when you withdraw antibiotics in these massive subtherapeutic exposure levels, that there is, in the absence of the antibiotic, a slightly greater survival advantage to the bacterium that's not carrying around that resistance gene. It's not true of all resistance genes, but some exact a toll on the organism's ability to compete. And so there's been encouraging reports of actual return to greater antibiotic sensitivity after a period of withdrawal. Whether that will happen in the human population, we're really in a critical place right now with regard to the dwindling number of bows of arrows in our quiver with regard to serious resistant organisms. Should we take one more, or yes?
One of the big changes in public health policy in my lifetime has been the government attitude towards tobacco use. So as a public health specialist, whose career spanned the pre-ban or the pre-suppression to the post, what lessons do you draw from the public health community and the regulatory community's approach to tobacco regulation, and how do you apply those lessons to some of the
That's a very an interesting parallel you're drawing. When Luther Terry released the first Surgeon General's report on smoking and health, the political pressure was such that he was forced to wait until Friday afternoon to release the report so that it would come out on a slow Saturday, Sunday, and not get much coverage. This was pre-internet, so of course people weren't looking at Google News and seeing 24/7 what was going on in the world. There were multiple efforts to bury the data. One of the first studies by a Japanese investigator of side-stream tobacco smoke among wives of Japanese men smokers was devastating in documenting the fact that women exposed to environmental smoke in the household had much higher rates of lung cancer and cardiovascular disease than women married to non-smokers. When that came out, the industry hired a scientist, a paid gun, to attack the Japanese investigator, not in the journal, not by writing a letter to the editor of the journal, which is the usual way of engaging in scientific exchange, but writing a popular article for a news magazine in which the author of the study had no opportunity to respond. So those tactics that characterized the way in which the tobacco industry fought every bit of new information about the health consequences of tobacco use may or may not be used by the big pharmaceutical industry. I have some medical school classmates who went on to work for pharmaceutical industry, and most of them seem to be people with integrity, but there are certainly some sobering lessons to be observed just from the way in which contemporary pressure is being put on the influencing of data, the suppression of negative results, the failure to publish studies that don't pan out the way the industry hoped they would with regard to a new drug. So I think we probably should pay more attention to thinking about the strategies the tobacco industry tried to use to suppress information about the harmful effects of tobacco and counter them as we try to get the information out to the public about antibiotic abuse.